Hello. Welcome to the Health Careers Program Nuclear Medicine Technology Information Session. My name is Tori Malloy. I'm the Program Coordinator for the Nuclear Medicine Technology Program at Triton College. My colleague Tiffany Irby is a Health Careers Information Specialist, and she is the first line where your application will be reviewed. Additionally, I have listed the Advising and Counseling Department's emails, and all of these emails are available on the Triton College website under Nuclear Medicine Technology. You have searched this information session out because you are interested in nuclear medicine. So what exactly is nuclear medicine? Nuclear medicine is an imaging modality that helps determine the cause of a medical problem based on the function of the organ. In contrast to other imaging modalities like ultrasound and X-ray, CT, MRI, nuclear medicine uses the function of the organ as opposed to the anatomy of the organ to help diagnose problems. What we do in nuclear medicine is use a very small amount of the radioactive material called radiopharmaceuticals, and these are administered to diagnose and help treat these diseases. There is not one specific disease that is treated or one specific therapy that is used. We do use radiation to help diagnose and help treat diseases. This radiation is done usually at a diagnostic level, and it is very safe. So if you are interested in nuclear medicine, I want you to make sure that you understand that we are using a radioactive material. As a nuclear medicine technologist, what would you do? You would work closely with a medicine physician. You would help prepare and administer these radiopharmaceuticals that I spoke of earlier. You work directly with the patient, you take their histories, you explain the procedures, and you help answer questions that they may have. In addition to these conversations that you have, you would also be taking images. These images are what allows the nuclear medicine physician to see what's happening inside this patient's body. And with these photographs, these images, you would help the physician interpret the results of the study and pass along the diagnosis to the ordering physician. So, is nuclear medicine a field for you? You have to ask yourself and tell yourself that you'll be working with patients. Sometimes these patients are very sick. You'll be responsible for effectively communicating with the patient. So communication skills are key. You have to perform and prepare injections of a radioactive material. So you have to be willing to use a needle, because 90% of the time we are using venipuncture to get the radioactive tracer into the patient's body. You have to be able to follow regulations and guidelines. Radiation is something not to be messed with. However, using safe practices and safe protocols, you can work for a very long time in this field. As a nuclear medicine technologist, you will be working on average an 8-hour shift. And sometimes this is very physical work. Sometimes you don't get much of a break. You will be working and processing using sophisticated instrumentation and computers. So if you are unsure of computers, then this is a field where you have to know that you will be using a lot of computers. You have to be willing to be part of a team. Not only is it important for teamwork, but occasionally you'll need some help. However, probably about 25 to 30% of the time, you can be functioning autonomously or by yourself. As a student in the Nuclear Medicine Technology program at Triton College, you're going to be working towards completing an Associate's in Applied Science. This program is a 5-semester long program. It starts in the fall and finishes 5 semesters later in the spring. So you will go fall, spring, summer, fall, spring. All of the courses build upon each other, so you cannot take them out of order. The only subjects that you can take out of order are those general education requirements for the completion of your Associates in Applied Science. However, all of your prerequisites must be finished prior to starting the program, and all of your remaining gen eds must be completed before you start your 3rd semester and your clinical rotations. You have to remember that the courses do require preparation and study to be successful, and it is recommended by the ICCD that for every hour of class you participate in, you plan on studying about 2 hours outside of that class per week. As far as cost for the program, tuition and fees, you can seek this out directly from the college. If you are out of district, your tuition will be different than in-district costs. However, if you have a community college by you that does not offer the nuclear medicine program, you can apply through the student services, financial aid, or registration. One of those departments can help you get the in-student tuition, in-district tuition. So please seek that out if this is a situation that applies to you. The suggested procedure for admission is that you would attend an information session similar to this one. Currently, all of our information sessions, due to the pandemic, are actually virtual. Then you would complete a college application, and after that college application, you would complete a program application. You also need to send all transcripts from high school and other colleges for complete admission review. If you are currently a Triton College student, then you do not have to complete the Triton College application. You would just complete the online program application. If you are unable to attend the information session, I do suggest that you reach out to me via email and arrange a time where you can get all of your questions asked from me. My email, again, was listed at the beginning of this information session, as well as it is listed on the website for the Nuclear Medicine Department. There are 3 prerequisites for this program, and they all must be completed prior to full admission into the program. Those include Physics 100, Math 110, and Human Anatomy and Physiology 1. If you take any of these courses outside of Triton College, please make sure that your transferability is appropriate. Sometimes courses are labeled Physics 100, for example, and they do not correlate with the Triton College Physics 100. So please make sure before you take a course that it will transfer appropriately. All of your math and science prerequisites must be taken within 5 years of starting the program. So if you are going to start the program in fall of 2021, they all have to be completed between fall of 2016 and fall of 2021. All of your prerequisite coursework must have a passing grade of a C or better. And if you are taking a placement test to try to place out of, for example, college algebra, that placement test must be taken within 2 years of acceptance into the program. So again, fall of 2021 would mean that your placement test has to be taken between fall of 2019 and fall of 2021. The Nuclear Medicine Technology program in general looks like this. You all semester the very first one, and you take classes in the morning on Tuesdays and Thursdays. Generally, the morning courses go from 8:30 till noon. In the spring, your second semester, you'll take courses on Tuesday, Wednesday, and Thursday mornings, again from approximately 8:30 till about 12 or 1. Your third semester is your summer semester, and you start your clinical rotations, generally Monday, Tuesday, Thursday, Friday, and you have class on Wednesday. This might change depending on prior rotations, prior cohorts, and the current pandemic. In the fall semester, you take your clinical rotation, your second one, which is Monday, Wednesday, and Friday, and your classes are on Tuesday, Thursday afternoon. Generally, those afternoon courses start about 12 and go until about 4. And the same is true in your final semester, the spring semester. You have clinical rotation Monday, Wednesday, Friday, and your classes are Tuesday and Thursday afternoon, again, generally from 12 till 4. This is the list of courses. Again, as I said in a few slides before, you can take any of the gen eds listed in semester 1 and 2 out of order or in particular order, as long as they are all completed before semester 3. All of the nuclear medicine courses, and those are identified by the first 3 initials NUM, those must be taken in this order. They build upon each other, so you cannot take them out of order. There is mandatory drug screening and mandatory background checks that are required as a student in the nuclear medicine program. I have the background checks taken between the first day of class in the fall of your acceptance year and within 2 weeks of starting the program. You are responsible for these costs as a student. The mandatory drug testing must be taken within a month of starting your clinical rotations, and you are responsible for these fees. More information on the drug testing comes just before we need you to complete it. The thing about the background checks is that your future employability and your ability to sit for your certification exams may be jeopardized by certain types of criminal convictions. So that is why we have the background checks taken early in the program, so that you do not waste any time with potential issues in your background check. If there is something that shows up on your background check, you can discuss it with me, and we can further decide whether or not something can be done, or you might seek another imaging modality. The other thing is that minor infractions that may not show up on your background check, you might want to search out. There are listings for the ethics review on the information on the website for nuclear medicine. And if you have some concerns about the ethics review for both certification exams, the NMTCB and the ARRT, please read those ethics requirements and seek that out as far as an ethics review. The worst thing would be if you completed your program and there was nothing showing up on your background check, but there was something in your past that did not show, that will show on an ethics review. So please, if you have some questions, please reach out to me and I can further explain this. As far as the outlook for a nuclear medicine technologist, salaries and jobs vary depending on where you are looking for your job. As a new graduate in the Chicagoland area, you have to remember that there are 2 other programs in the Chicago area that do put out students. Triton allows you to complete an AAS, and we graduate our students in May, generally speaking. The other two programs do graduate students later, do graduate students later in the summer. One is in June and one is in August. And so that means that you will be competing with other technologist students, recent grads in the Chicagoland area. Approximately, salary looks approximately like $55,000 a year, depending on what you are, where you are placed, where you get your job, and what you're willing to do. Certainly, you can search out the Department of Labor information nationwide as well as just in the state of Illinois. However, all that being said, there are jobs out there, part-time, registered full-time. It all depends on what you want to do. Areas of employment for graduates include hospitals, outpatient clinics, mobile services. You could leave nuclear medicine with the information that you have and go and work for a computer software company, designing the software used in the images. You could also be a salesperson. Additionally, after completing your AAS degree at Triton, you could go back to school and get additional certifications for either computed tomography, ultrasound, MRI, or even radiation therapy. So there's a wide range of things that you can do with this degree. As I mentioned, upon program completion, in order to work in the state of Illinois, you need to pass a certification exam and obtain a license. The license in Illinois is obtained from the Illinois Emergency Management Agency. If you choose to work elsewhere in the nation, you do not need an Illinois license, but you do need a certification exam. And as I said, you can pass one of two. As a graduate in my program, I do encourage you to take both certification exams. Both of these exams, the websites are listed here. You have the NMTCB, stands for the Nuclear Medicine Technology Certification Board, and the ARRT. You can go to these websites and see what is necessary to be able to sit for these exams, but as a student completing the nuclear medicine program at Triton, you are capable and qualified to sit for these two exams. This program at Triton College is accredited by the Joint Review Committee on Education Programs in Nuclear Medicine Technology. That whole long name is shortened to the JRC NMT, and you can go to their website and see all of the accredited programs in the nation. Finally, as a student in the Triton program, you are automatically able to obtain a student membership for the professional society, the Society of Nuclear Medicine and Molecular Imaging. I do use several websites or webinars from this program, from the professional society. You also, based on your student membership, have access to discounts in their bookstore, as well as when we attend meetings, you get a student discount. So this is the end of the lecture for the information session for the Health Careers Program, Nuclear Medicine Technology. I do encourage you to email me if you have any questions. I would be happy to discuss any questions that you have and offer any other insight that you may wish as far as nuclear medicine technology. Thank you very much, and I look forward to hearing from you.